I'm Joseph Osorio. I'm a neurosurgeon. I focus on complex spine conditions, and I'm the director of Spinal Oncology and Deformity surgery. My approach to patient care is unique. I would say that my training in neurosurgery and also my complex training in orthopedic spine surgery allows me to look at the spine in multiple ways. I then can individualize my care to patients to give them the best possible outcome and treatment for their complex conditions. I think the thing that I love most about being a physician is the ability to impact someone's quality of life. Many times when I meet patients, they're in pain, and if I'm able to treat their pain, it's incredibly grateful to be in that position. I would say that patients also come to me and they have disabilities. Some patients aren't able to walk. Some patients have a numb arm or a limb or have weakness. Having the ability to impact that directly is really powerful and something that excites me every day. Someone who needs a complex spine surgery should come to UC San Diego Health because we have the ability to look at patients from a multidisciplinary approach. We work together with other spine surgeons every week to evaluate each surgical case to come up with the best possible plan. In addition, in the operating room, we were the first to apply patient-specific implants, and that's been incredibly successful. Also, we use an intraoperative CT scan in order to verify our implants, and that allows us to know that we have the appropriate outcome before we left the operating room. We also utilize robotic spine surgery, and that allows us optimal ways of doing minimally invasive spine surgery. The one thing I want scoliosis patients to know is that the field has advanced tremendously. It's changed over the last 30 to 40 years, but it's also changed tremendously in the last 5 or 6 years. I would say that now patients who have scoliosis, who suffer from pain, we're able to treat their pain. We're able to give them a better understanding of how their scoliosis will change over time, and I want them to know that we can do that safely in the operating room. I would say the aspect that I enjoy most about working at UC San Diego Health is working alongside a team of physicians that are leaders in the field. They're all specialists, and often when we deal with complex spine pathologies, you have to lean on those specialists to work together to find the appropriate solution for patients. It's also incredibly gratifying to teach the next generation of surgeons working along residents and fellows, and that environment is incredibly stimulating.